One of the things I appreciate most about my own practice here at Inspired Psychiatric Care is the time I get to take with our patients. Our intakes are typically 90 minutes long, and each visit is a minimum of 30 minutes long. Because it's in the taking time that you really get to listen. And I'll tell you a quick patient story, because it's in the listening that you can then make a differential diagnosis that can make a huge difference in the lives of patients. I saw a patient just recently who came to me who'd been diagnosed with bipolar disorder. Bipolar disorder is pretty complicated, particularly when we're talking about a certain type of bipolar disorder called bipolar 2. More problematic with the diagnosis of bipolar disorder is that oftentimes medicines in what's called the atypical antipsychotic class can be prescribed to manage this bipolar. And they're fine medicines, don't get me wrong, but one of the side effects is weight gain. This particular patient was very, very tearful when we started our interview, very, very anxious because she'd been diagnosed with this bipolar disorder after having been hospitalized. And it was in the listening that I realized that she probably, most likely, did not have bipolar. What she had was a manic episode that was induced by the overuse of stimulants. She herself had admitted that she's a nurse, a professional, a mom, she's married. She'd suffered a significant trauma earlier in the month. So there were reasons she was overusing her stimulants. When I said to her, no, I don't think you have bipolar disorder, and yes, I think we can stop the Vraylar, the atypical antipsychotic, and start an antidepressant, just the relief, the sheer relief that went through her body was palpable. She in fact became quite tearful. So, the gift of listening and the art of listening, of taking time and holding space is something that I value as a provider and that we at Inspired Psychiatric Care value.